It has to go someplace, and that's the fluid that goes out. And it blows up and it hurts. So when we get in there, we determine whether or not the tooth is worth, if it's too far decomposed, if it's too far gone, to clean the abscess under the tooth. The tooth itself is okay. Structurally, the tooth is okay. It's not, to me, it's not broken.
It's just the under and the outer are so mainly just the under.
You got 4 weeks. I'd say more than that. You probably got 6 months or 8 months worth of festering bacterial contamination under the tooth because the tooth died. And when it dies, it decomposes, and that product of decomposition causes your immune system to attack the tooth. Gets up under it, and it protects your body from allowing that bacteria to go to your entire system, right?
Okay.
So it gets up under there, and then it causes the destruction of the bone, which then causes the bacteria to want to bore out and get out. And then you're at that stage now. So depending on how advanced that infection is, that'll make a decision whether the tooth is worth keeping it. Right? If it's not worth keeping it, then you got to take it out. And then you have to graft the site. We'll talk about that later. I'll make that determination once we work on the tooth. So you need to be put on an antibiotic ASAP. Then you need to have a root canal started ASAP. Starting the root canal and finishing the root canal are two different things. So once we start the root canal, we're going to take all this crap that's inside, get it out of there, we'll flush it and get it out. And then we're going to drop medication through the tooth, so that medication, gravity pulls it down, and it goes up underneath the bone. And then it helps your immune system to get rid of the bacteria. That's step one. Step two is to see how successful we are. If we're not successful because of the length of time the abscess has been there, then that's when you say, forget it, take the tooth out. Prepare the site and later put an implant in. Or something like that.
Yep, gotcha.
Okay? There will be an examination of the way out. You get a lead pencil and you're going to take an assessment. If you fail the assessment, you're going to stay here all night and remediate.
as long as I got some food, man.
Right, are you allergic to anything?
No.
Right, so we need to start endo on him ASAP. ASAP is pretty funny because
I'll find the spot.
ASAP is pretty funny. So ASAP in our lingo means as soon as possible. But if you ask Haley, my as soon as possible is in December someplace because I have a lot of work. We'll try to fit you in because this is important, okay? So you're not allergic to it, so let's pen a prescription of amoxicillin, 500. Let's give him 24 because I don't know how long it'll take you to get them in. But you're going to get 24 antibiotic pills. You're going to take 12. 4 days. One every 4 hours. 4 days. One every 6 hours for 4 days. And then you're going to stop. You're going to have 12 left. Then, depending on when your appointment is, whenever they get you in, then whenever the appointment is, you're going to start the other 12 the day before the appointment.
Gotcha.
So we're always covered in that. Right now I want to protect, and then the other stuff is when I actually open up in there, we'll find out. Because there'll be a fight down there.
Okay, so you saying it's 24 pills altogether?
Yep.
Take the first 12.
Yep. One every 6 hours.
Then when
4 days.
when I say I got 12 left, I gotta time it right.
You gotta time it with the appointment. That's why I'm giving you 24 of them. You have 12 and 12. 12 you'll take now to protect, and then the other 12 are to start the root canal. So once I start the root canal, there's going to be a fight. I'm going to fight your bacteria. I'll tell you, I usually win. Sometimes they beat me. Okay, so I'm going to fight on your behalf.
So what is the antibiotic for? Just to
So your immune system, your circulating system, your red blood cells.
say if I didn't want to take the antibiotic, would it be a big difference?
Well, you want the worst case scenario or the simple case scenario?
I don't really like taking pills, but
it's up to you. I'm telling you, you need it, but you don't always not take it.
Yeah.
You can always run the risk of becoming septic. You ever heard of that word, septic?
Yeah.
Septic means an infection in the mouth, in the
Gotcha,
dental
gotcha.
environment.
Gotcha.
Can make you systemically sick. It can compromise you systemically,
Gotcha,
or you can end up in a hospital because of sepsis.
Yeah, gotcha.
So I'm trying to protect that. Now, you're a young guy, right? You're healthy. How old are you? You're 25?
I wish. 38. I wish I was 25.
You don't look 25, but you don't look 38 to me. But anyway, regardless of that, the older we get, the more susceptible we are, all of us, to sepsis.
Gotcha.
And so I'm protecting you against sepsis. Whether you take it or you choose to take it or not, I got to do the right thing for you, and then that's your choice to take it or not to take it.
Gotcha.
Other than that, then it becomes your choice to either get sick or not get sick.
Gotcha.
Right? And then I'll work on the tooth to make sure you keep it. And then I gotta tell you that, why do you think this happens to that tooth? Why do you think this could have happened to that tooth?
Maybe not taking the proper care of cleaning for it or something. Or maybe
No.
when I was eating something and something happened, I didn't get it taken care of
Let
right then.
me just use a little broader paintbrush to paint this for you. When you smiled, I see you're missing some teeth on the upper, right? So you've taken those teeth out. So consequently, those teeth that are missing can't work because they're missing. So your bottom teeth can't work because they don't have the top teeth to work, right? So what happens?
So I'm using it a lot, right?
So
Using it.
if you were a ballet dancer and if I asked you to stand on your tiptoes to do a plie or something, you'd say, I could do it for a minute or two. But if I said to you, do it 24 hours a day, I think your calves would kill you, right? Because our muscles are not designed for that.
Gotcha.
Our chewing muscles are not designed to work exclusively on one
I
side.
know. Gotcha.
You're overworking them.
Yep, that's exactly.
And that's what
No,
happens to
that's
these teeth.
exactly what it is. That's what I meant to say. Overworking. Because if I can't eat it on this side, I got to eat it on this
Listen,
side.
you're hired. You may have to wear a scrub or something, but you're hired to give explanations here.
Hey, you
Toy-
gonna hire me?
toy
You gonna
is
hire
it?
me to work? I need a job.
You said toy, right?
Yeah.
T-O-Y?
Yeah. T-O-I.
T-O-I, okay, all right. Yeah. So it's not the toy that we think it was, it's just T-O-I.
Yeah.
So where's that name from? How's it?
Oh, it's from the Bible.
Okay,
Yeah, biblical.
biblical, bingo. Good name, I
Did
like
they
it.
give you an estimate at the last office?
He has Guardian, you said?
Guardian
Yeah.
insurance.
He has decent insurance, I believe. So whatever that is, just pen that and I'll sign it for him. And
Okay.
take care of yourself, Toy. And remember,
Thank you, Doc. I appreciate it.
it's up to you to take the antibiotic. I recommend it.